Childs. I'm a board-certified chiropractic neurologist, and I'm here today to talk to you about stroke rehabilitation. I'm going to talk to you about our stroke rehab program. If you're watching this video today, either you or a loved one has suffered a stroke and you're looking for some answers. Possibly you've already been through rehab and you haven't regained all of your function that you would have liked to have regained. Maybe you've gone through rehab and you're just not satisfied with the results, and or maybe it's been years. You've dealt with a stroke years ago. You did rehab years ago, and you're looking to see if you can regain some more function. Well, we're going to talk to you today about stroke rehabilitation. There's really two sides to stroke rehabilitation. One side is functional neurology, and the other side is functional medicine. We're going to talk about that today. Before I do that, let me tell you a little bit more about myself. Again, I'm a board-certified chiropractic neurologist. Now, what is a chiropractic neurologist? Well, just like in medical, as a medical doctor, you can specialize in different types of fields. You can be a medical neurologist, a medical orthopedist. In chiropractic, you can also specialize. So you can have an additional schooling and training and become board certified in the specialty of chiropractic neurology. The only difference between me and a medical neurologist is that I treat without drugs and surgery. We treat with neurological rehabilitation, brain stimulations, specific types of nutrition, and metabolic care. And that's what we're going to talk to you about today. Again, I'm fellowship trained in functional neurology. Again, that's just drugless neurology. I've been fellowship trained in child neurodevelopmental disorders, so we see a lot of kids with neurodevelopmental issues. I'm also trained in functional nutrition and functional medicine, which is basically metabolic-based care, and I'm also trained in blood chemistry. I'm also trained in spinal decompression and biomechanics, and I'm also an exercise physiologist. So that's a little bit about me today. So let's go over a couple of stroke stats just so you can understand the scope of the problem. There are 731,000 strokes that happen every year in the U.S., and there's a new stroke every 43 seconds in this country, and it's the leading cause of long-term disability in the elderly. There's really two types of stroke. You have a hemorrhagic stroke and you have a ischemic or occlusive stroke. A hemorrhagic stroke, 9% are caused by hemorrhage into the deep parts of the brain, usually due to blood vessel bursting, one of the important blood vessels in your brain, usually caused by long-standing high blood pressure, hypertension. And then you also have the ischemic stroke. It's also called an occlusive stroke. That's basically an obstruction to the blood flow. That can be caused by a thrombus or a blood clot or arteriosclerosis, that type of thing. Brainstem strokes are less common. Usually it's going to happen in the cortex of the brain. Here's some stats with disabilities 2 weeks after a stroke. Weakness in one side of the body. A lot of times patients will lose function on one side of their body, because if you have a stroke in the left side, you're going to have some spasticity where the arm comes up here. That's a stroke posture, and your leg is externally rotated. Trouble walking, speaking difficulties, because there's certain parts of your brain that allows you to understand comprehension. That's called a receptive aphasia, or it's a Broca's aphasia. You can't speak well. Vision loss, depression. Some people need help with daily activities. So you can see stroke, really affects people's lives because it's affecting the nervous system. Stroke recovery, 10% of stroke survivors recover almost completely. 25% recover with minor impairments. 40% are going to experience moderate to severe impairments requiring special care. 10% require care within either a skilled care or long-term care facility, and 15% die shortly after the stroke. 25 to 50% are going to experience another stroke. So there's some pretty staggering statistics there about stroke. So here's the deal. What makes us different from every other doctor you've seen, from every other doctor that's tried to do rehabilitation on your stroke? And we're going to talk about it today. We treat stroke patients metabolically and neurologically. So we use functional neurology and functional medicine. That's what allows us to help patients recover some function that they thought they were never going to get back. Unfortunately, most people, or a lot of people that have had a stroke or suffered a stroke, they really get rushed through rehab. They get rushed through the system. they don't get fully rehab, meaning they get discharged, and there's still a lot that can be done to regain function. I mean, don't get me wrong. I mean, stroke rehab has come a long way, and a lot of patients have done really well with that. But there's usually a lot more we can do in really gaining a lot of function. I mean, you may be left with spasticity in your arm. We may be able to reduce that quite a bit. You may have some visual disturbances that we may be able to help. We may have depression, different things like that. We can help patients using this metabolic and neurological approach. So again, your brain needs two things, your nerves and your brain. They need fuel and they need activation. Fuel is oxygen. So we use oxygen in our office with all of our rehab. So patients do rehab on oxygen. Your brain needs glucose for it to survive. It needs activation, which is the stimulation, the brain-based rehabilitation that we do in our office. We leave no stone unturned in getting you the most stroke recovery that you possibly can get. That's important. We want to try to get you to as much function as you can possibly get. So, metabolic care. Metabolic care is essential because metabolic care is fuel for your brain. Your ability to heal is directly related to how healthy you are metabolically. So we're going to run a complete metabolic panel, a lipid panel, a complete blood count with auto-differential. We're going to run a thyroid panel. We're going to run thyroid antibodies. Now, usually at this point, patients will say, Dr. Childs, I've already had all those tests. They ran them plenty of times, and they're all normal. But here's the deal. They're definitely not normal. And the reason why they're not normal is because the doctors that look at them look at what's considered lab ranges. You know, when you have your blood work, all the ranges are on that one side. They're called laboratory ranges. They're inaccurate, and they're also way too broad. The reason why they're too broad is because what happens is the way they've come up with them is they look at the average of everybody giving blood, meaning the sickest of sick, people with really compromised immune systems, you name it. And so you're the average of those people. That's not going to be enough to allow you to heal, especially if you're trying to heal brain tissue, okay, and to try to improve the function in brain tissue. So we use what's called functional lab values. Functional lab values are more sensitive. They're a lot more tight, okay? This is why your lab test may look normal, but you still feel terrible. You still feel sick. So I'll give you an example. Glucose, normal glucose, or let's say lab range glucose, is 65 to 110. That's a very broad, 65 to 110. This is the sugar in your blood. Functional ranges that we use are 85 to 100. And that means that you may be, let's say you're using the lab ranges, you may be 110, which is only 17 points away from being diabetic. And that would be normal to your medical doctor. Maybe a little high. 85 is normal for functional, 65 is normal for lab, so you could be 65, 66, 67, and they're going to say that's pretty much normal. But that's hypoglycemia, that's reactive hypoglycemia. And that really will affect your stroke rehab. You're not going to be able to have proper stroke rehab and brain rehab if you've got these tests that are off. We run metabolic tests, we run something called an adrenal stress index. Your adrenals are the glands that sit right on top of your kidneys, and these are your stress glands, and they secrete cortisol when you're stressed. A lot of people are very stressed when they have a stroke. I mean, that's brain stress, and they're stressed because they've lost some function. I mean, their life has been changed, and so usually they're going to have adrenals that are completely shocked. They're not creating enough cortisol, or they're creating too much cortisol, and that really affects brain. Cortisol is toxic to your brain. It shuts down your hippocampus. So if you've lost memory because of your stroke and you have really high cortisol, which we can tell from doing a salivary adrenal stress index, you're not going to heal well. It's going to adversely affect your rehab. I don't care what rehab you're doing. It's not going to be as good if your adrenals are shot. We do what's called sensitivity testing. Sensitivity testing is testing you for food sensitivities, gluten, casein, eggs, soy, yeast. Sensitivities are not good for your body because what happens is if you have an allergy, or not an allergy, but a sensitivity to gluten or casein, it creates an autoimmune reaction in your body. It creates inflammation in your body, which crosses the blood-brain barrier and creates brain inflammation. So if you have brain inflammation, there's no way your rehab is going to work good, okay, if you continue to eat these foods. How do you know if you are sensitive? You don't know. You have to run the test. That's the only way you can tell. But some people that have food sensitivities, they may get chronic pain or fatigue, frequent indigestion, fullness after meals, bloating after meals, frequent loose bowel movements, constipation. They may vomit a lot. Or you may have absolutely no symptoms at all. You may have brain fog. Okay? We run an intestinal permeability test to see if you have a leaky gut syndrome. Your gut health is essential to your brain health. Okay? In fact, a lot of people consider the gut the second brain, so to speak, because there's so many nerves in there. But anyway, the goal of your gut is to provide a barrier between the food that you're digesting and your bloodstream. The only thing that should get through the gut wall is foods that are completely digested. So let's say you eat some wheat or you eat some milk. The protein in the wheat or milk needs to be broken down from big proteins to peptides to amino acids. They need to be small, so the amino acids go through the gut. The only thing that should get through are the amino acids, but if peptides get through, that's a problem. Because when amino acids, which are the small parts, get through, your immune system cells cannot recognize them. And they're fine, so then they're used to nourish your body. But if the peptides get through, they're bigger, and your immune system is going to notice these proteins in your bloodstream. And what it does is it thinks it's a virus or a bacteria, and it starts attacking those proteins. And these proteins can be gluten, soy, and we can do a test to find out if you're sensitive to that. Well, that creates a ton of inflammation, and it's going to cause brain inflammation. If your brain is inflamed because you consistently eat foods that you're sensitive to, there's no way your rehab is going to work good. You see how the metabolic side is so important to the neurologic side? If you have an autoimmune disorder, you have brain inflammation. What is an autoimmune disorder? It means that your own body is attacking itself. People have underlying autoimmune diseases, which means they're undiagnosed. It's a condition that means your body's attacking itself. Okay? And we can do specific tests to find that out. We can run TMB lymphocyte and natural killer cell. We can run cytokine panels, which are interleukin-2, interleukin-4, interleukin-10, TNF-alpha, which is tissue necrosis factor alpha. We can run these tests. There's two parts of your immune system, TH1 and TH2. TH1 and TH2 need to be balanced. They need to be functioning at the same power. If TH1 is too little, that means you're TH2 dominant. If TH1 is too high, that means you're TH1 dominant. If you have a dominance, it means you have an autoimmune problem. TH1 is your T cell cytokines, interleukin-2 and TNF-alpha. We can test. That's how we know if you have a dominance. TH2, interleukin-4 and interleukin-10. These are your B cells. Back to TH1. T cells are the cells that go out and attack any antigens, okay? Any food sources, any bacteria or viruses. TH2 are your B cells. They don't do the attacking, but they put little tags out and let your T cells know what they should attack. They're called antibodies. We need to determine if you have an active antigen or immune dysregulation. Active antigens are parasites, bacteria, viruses, molds, yeast, fungi, protozoa, these type of things. Chemicals, heavy metals. These are things that you may have in your body that your immune system is trying to kill, but it can't kill. That's an active antigen. Immune dysregulation means that you have anemia. Listen, if you have anemia, there's no way your brain's going to ever get better, okay? Because your brain needs oxygen, it's fuel. Anemia means you don't have enough red blood cells, or you have not enough function in your red blood cells to get the oxygen to where it needs to go. If you have immune dysregulation, it can be secondary to anemia. It can be secondary to your adrenals not working good. It can be secondary to blood sugars that go up and down and all around. All right? The best indicator to find out if it's an active antigen is what's called the helper-suppressor ratio. We can run that. And we can do what's called the CD4-CD8 ratio, which is the helper-suppressor ratio. If it's above 2.5, then you've got something in your body that your body's constantly trying to attack that it can't kill. It could be gluten. It could be the wheat that you're eating. It could be yeast in your intestines. If it's below 2.0, then it's some other source. It's an immune dysregulation. We do what's called the DNA stool ecology profile. That's going to determine, do you have dysbiosis? Do you have improper levels of healthy bacteria? Too much bad bacteria? Do you have parasites? Do you have yeast that's too much? If you have yeast, that's going to damage your gut. Here's the thing. You can have a leaky gut and have absolutely no gut symptoms. The symptoms may be antibodies that are attacking your brain. We can run a panel that looks at all these different antibodies. We can test for cerebellar antibodies. The cerebellum is the back part of your brain. If you have cerebellar antibodies, that means your own body's attacking your cerebellum. Not so good for brain rehabilitation, okay? So we can test for all this. We can test for H. pylori, which is to see if you have upper GI bacteria. Inflammation. We can test for C-reactive protein. We can test for homocysteine. Remember, we said people with strokes usually get another stroke. If you have high levels of C-reactive protein and homocysteine, it means that you have inflammation. If you have inflammation, you have a higher chance of developing another stroke. Okay? If you have blood sugars that are out of order, blood sugar causes increased clotting. That increases your chance of having a second stroke. So it's not just about rehabbing the stroke you have now, it's about preventing the one that could potentially get you in the future. Okay? We can test you for neurotransmitters, brain neurotransmitters, dopamine, serotonin, acetylcholine, okay? GABA. These are neurotransmitters that may be off because of your stroke. And we can do a survey. There's a sheet of paper that you're going to fill out, and we can get an idea of what we need to support. We support it with natural supplements. We can do hormone panels to see if your hormones are off in any way. Once we find out what's not functioning well, then we do specific dietary changes. We're going to give you specific nutraceuticals that are going to help your brain function better. We can put you on specific types of nutrition approaches that increase blood flow to your brain. Okay, increased blood flow to your brain is going to make your rehab work better. Something called NeuroO2, NeuroFlam. We can do fatty acids. We can put you on something that will heal your gut if we find out that you have leaky gut. If you have an autoimmune problem, we can put you on something that's going to regulate your immune system. And we do that without drugs. We also use something called glutathione. Glutathione is a vital antioxidant. It's like it takes the bullet for any heavy metals or anything that's attacking your body. So it's very important. It's like they call it the bulletproof jacket for your body. And so we put patients on glutathione. It's going to help their cells heal, brain cells. Okay. Have you had all these tests performed? The question is, have your doctor checked you for these things? Have the doctors that's working for you with your stroke rehabilitation, did they check all these things? Now the reason why they didn't is because they're not really trained in checking for these things. You have to be a doctor of functional medicine to do this type of work. So the doctors aren't necessarily bad people, so to speak, because they didn't test you. It's just not their it's not their approach. It's that, they have a very standardized approach to helping people with chronic conditions, and usually they don't do these tests. So you have to do these tests if you want to get well, or if you want to get as much rehab as you can possibly get. Neurological treatments based on specific neurological testing. So we talked about functional medicine. The next thing is functional neurology. So when you have a stroke, it's going to affect a certain blood vessel, which is going to affect certain parts of your brain. Does it affect your frontal lobe? Does it affect your parietal lobe? Does it affect your temporal lobe? Does it affect your cerebellum? Does it affect your occipital lobe? And we'll be able to determine based on, you'll bring in any imaging that you had, and also we'll also be able to determine based on doing a specific neurological exam. We're going to run right and left blood pressure, because patients with stroke on one side may have higher blood pressure on one side of their body. We're going to test you for tissue oxygen saturation and tissue perfusion. How well is blood getting to your extremities and your brain? We're going to look at heart rate, heart rhythm, salivary pH. We're going to look at your reflexes. Are your reflexes real spastic because you have an upper motor brain injury? Usually we see that with strokes. We're going to look at eye tests. Are your eye tests off now because your brain is not working well? Cranial nerve test, cerebellar test. Patients with strokes usually have poor cerebellum function. That's why they may have balance disorders and things like that. So we're going to run those tests. We're going to do specific treatments and specific testing to determine, as we look at your brain, which part of your brain was affected. Now, a lot of that we can find out by looking at the imaging, but the other thing is we can run tests. Was it up in here, like the midline of your brain is going to be your legs, which is going to be the anterior cerebral artery, which is going to affect your legs? Is it your shoulder? Is it your wrist and your hands? Is it your fingers? Is it your face that you have numbness? Okay, things like that. Is it your tongue? Is it that you're having trouble speaking, which is Broca's speech area? And so we can get an idea of where in what's called the homunculus you've lost your function. Okay, we do that with our tests. Again, the brain and the nerves need fuel and activation, so it doesn't matter how much rehab we do. If we don't get the fuel right, you're never going to get as much out of your rehab. We do oxygen therapy. This is very important because the brain needs fuel. This is why we put patients on oxygen therapy. So if you can't move your arm here, we're going to get you to move this side. We're going to make you work this side. We may do what's called mirror image therapy, but we're going to do it while you're on oxygen. We're going to have you do exercise with oxygen therapy because it's fuel and activation to change the way your brain functions. We use what's called an oxygen concentrator. It delivers 95% pure oxygen. We use it while you exercise in rehab, and it activates your cerebellum, fuel and activation. So we don't use tanks, we use concentrators. We use brain-based therapy. We use something called the interactive metronome. I'm going to talk about that. Interactive metronome works on rhythm and timing. It's been studied to be a great resource for patients that have stroke issues and stroke rehab. We may use what's called eye lights for people that have occipital lobe strokes. We may use OPK tapes, which is a red and white tape that's going to work with eye movements to help you improve. Okay? Interactive metronome is a specific computer-based program. You're going to put these headphones on. You're going to listen to a reference tune, and you're going to have to try to hit it as it works. If your right hand has the stroke on that side because you have a left brain stroke, we may have you actually use your left arm to take your right arm and actually press on the trigger. But you're going to listen to this reference tune, and you're going to hit it. You're going to try to hit it right at the same time. So that's an auditory stimulation, which is temporal lobe, and it's also going to be visual stimulation, which is occipital lobe, and it's going to be using gross motor activity. And the goal is to create neuroplasticity. Neuroplasticity means that your brain can change. You may have an area in your brain that has died because of the stroke, but there's other areas around the brain that can start to take up some of the function of the area that died. Now, please let me understand. I want you to understand something. I am not guaranteeing you right now that you're going to have complete 100% recovery. I can't say that, because after a stroke, you've had some brain damage, right? But what I'm telling you is that there's other parts of your brain that can start taking up the slack. That's what we call neuroplasticity. The interactive metronome, which we use on all our stroke patients, it'll improve mental interval timing. It's going to improve the brain's efficiency and performance. It's going to improve auditory processing, which is your hearing. It's going to improve your memory, your working memory, your processing speed, your cognitive resources, your executive functions, your motor coordination. People with strokes have lost their coordination. Okay, sensory processing. The interactive metronome works on the dorsolateral prefrontal cortex, which is the frontal lobe. It works on the basal ganglia. A lot of people with lacunar strokes have basal ganglia issues. The cingulate gyrus and the cerebellum, that's what it works on. Other therapies that we use, again, we talked about oxygen therapy. We're going to use neurological adjustments. So let's say you have a right-sided brain stroke. We're going to adjust your spine on the left side to fire the messages over to the right side. It'll increase the firing on the brain on the right side. We'll do balance therapy. We may do calorics, warm calorics. Some patients need cold calorics, which is water that affects the vestibular system. Auriculotherapy, which is for patients that have decreased function in their lower brainstem. We may have you do smells, which is temporal lobe and frontal lobe stimulation. Very important. It all depends upon what areas of the brain. We may have you do colored lenses. We may have you look at special letters, eye exercises, mazes and word searches, large letters made of small letters, music therapy or nature sounds. Metronome is music therapy. A lot of patients with stroke, because it affects their posture, will start to have a lot of back problems. And so we can use what's called the ATM2. ATM2 is a special type of therapy that strengthens muscles in your spine and gets you more upright so you stand straight. If you bend to the right or bend to the left and you have pain, we can put you in this machine here, and what it'll do is it'll help you exercise with some support around your spine, and it'll make some of that painful range of motion go away. Very important to do. A lot of patients that have strokes also have a lot of degenerative disc problems. They have bulging and herniated discs in their lower back. And, you know, a stroke is bad enough, but now they've got this pain in their lower back because they'll start to lose their function in the muscles and things like that in their body after they have a stroke, so they're now more prone to having back injuries. So we use what's called non-surgical spinal decompression to take the pressure off the discs. It's also a great stimulation for the cerebellum. And when we do it, we have you on oxygen therapy. Almost everything when we do rehab, we have you on oxygen because it's fuel for your brain and nervous system. If you have spinal biomechanical issues, we're going to give you spinal biomechanical correction exercises to strengthen the curves in your spine. So let's say you've got a left-sided brain stroke and you're kind of forward like this. We may give you some exercises and some spinal care to start to straighten up your spine. This is a pre-X-ray. This is a post-X-ray of somebody we corrected. Here this is the curve they needed in their neck. they were this far forward, and through a course of care we restored the arc back in their neck. The person had chronic neck pain, and now we restored the neck function, so that's very important also. We can do laser therapy, which is going to reduce or eliminate acute and chronic pain, decrease inflammation. Basically what you're seeing is we do a lot to help patients with stroke issues. If your rehab is going to be to the fullest, what you're going to need to do is you got to get yourself as metabolically healthy as possible. And once you get yourself metabolically healthy as possible, we need to hone in and try to rehab and try to get other parts of your brain to start to take up the slack for the areas that have been destroyed from the stroke. We also want to prevent the chance of you having another stroke. So a couple questions. How has your stroke affected your relationships, your family, your finances, or other activities? Are you enjoying life to the fullest? How has the stroke affected your life? Okay, even if you had the stroke 10 years ago, I mean, everybody's brain has the ability to change. So the question is, are you living life to the fullest? Do you feel like you're as rehabbed as you can possibly be? What has your stroke cost you in time, money, happiness, and sleep? I mean, a stroke is probably the most stressful thing that can happen to your body. So it's obviously affected your time and your sleep and your happiness and money. It's probably costed you a lot of money in supports and rehab and things like that. Where do you picture yourself in the next 3 to 5 years if you do not rehabilitate your stroke to the fullest? If you don't get the most out of your rehabilitation, what's going to happen is you're going to have continued loss of function. Because as we age, we start to lose function even further. And what is it worth to you to rehabilitate to your fullest potential? The reason why I ask that is because I don't accept every patient in my office. When a patient comes in, I let them know that, hey, listen, this is going to be work. This is going to take time. This is going to take effort. We may find that you need to change your diet completely. You may be eating gluten that is creating inflammation in your body that's totally affecting your brain. Okay? You may have cerebellar antibodies and an underlying autoimmune condition that we need to put you on a special diet for. And so the reason why I ask you what is it worth to you is what is it worth to you in you making these changes? Because we only accept patients that are truly wanting to change and try to get the most out of their rehab. So keep that in mind. Think about these questions. Think about how your stroke has affected your life. And think about if you think you've been fully rehabilitated, or do you want to see if you can improve your quality of life. Try to get more function. So if you're interested in stroke rehabilitation and you're watching this on the web right now, you can put your information in below and we'll send you some information on how to get a reduced cost stroke rehabilitation consultation and neurological evaluation in our office. If you've already been in as a patient and you're home watching this before you report of findings, make sure you watch this. Make sure your significant other, if you do have a significant other, watches this as well. And when you come back, I'm going to go over all of the neurological findings from your stroke rehabilitation, consultation, and examination, and then we'll let you know if we can help you. So thanks a lot for listening, and take care.